Welcome to the Micromodule series, Understanding Bias in Epidemiological Studies. In this module, we will be focusing on selection bias caused by lack of allocation concealment in randomized trials. The objectives of this module are to explain how lack of allocation concealment may lead to selection bias, illustrate it with an empirical clinical trial, introduce how to address the bias, and explain its difference from the bias arising from sampling procedure. In randomized controlled trials, randomization or random allocation means to allocate subjects to treatment or control groups randomly. You may refer to micromodule number 15 for the details of this concept. For now, just keep in mind that randomization is fundamental to randomized controlled trials. It ensures that subjects are assigned purely by chance, which is a necessary and crucial measure for removing confounding bias. For this purpose, researchers typically generate a list of random numbers, also known as random sequence, using a computer program. For example, if 100 subjects are to be recruited for the RCT, then 100 random numbers will be generated. Each subject, if assessed as eligible for the trial by the recruiter, will be assigned a random number that indicates the following treatment scheme. For example, trialists may allocate subjects with even numbers to the treatment group and those with odd numbers to the control group. This kind of treatment allocation scheme, that is, which number corresponds to which group, is pre-specified. But is that all it takes to eliminate confounding? There is one more critical point. The person responsible for recruitment should not know the allocation scheme when he or she assesses the eligibility of subjects. Otherwise, his or her decision to recruit a subject or not would be affected by this knowledge. This is why we need a process called allocation concealment, which means to conceal or hide the treatment allocation scheme from the person recruiting subjects. By doing so, we prevent selection bias and help maintain the integrity of the randomization process. Let's look at an example to better understand this concept. Consider an RCT comparing a new bone substitute with the current method. A spine surgeon who personally believes this new substitute is superior to the current method and wants to demonstrate its superiority is responsible for recruiting subjects. A list of random numbers has been generated by computer, and the eligible patients will be allocated to the new bone substitute or the current method according to the number he or she receives. Now, a male patient being assessed by the surgeon meets all the inclusion criteria, but he has some comorbidities that make the surgeon believe he is less likely to have a successful outcome with the new bone substitute. What happens next depends on whether allocation concealment is properly done. If allocation is concealed, the surgeon does not know which treatment the patient will be assigned to. As the patient meets the inclusion criteria, the surgeon will decide that he is eligible, recruit him, and then refer him to other research staff who will then assign the patient according to the random number. Everything goes as planned without being affected by the surgeon's preferences. The process is free from bias. However, suppose the surgeon knows that the patient, if recruited, will be assigned to the new bone substitute, which he personally does not want to see because he thinks the patient would not benefit from it. Because of this knowledge, he may consciously or unconsciously find a reason to exclude this patient. Even though the patient meets all the inclusion criteria, this will lead to selection bias, as those who have comorbidities and are less likely to have a successful outcome with a new bone substitute are excluded. The benefit of the new bone substitute demonstrated in the RCT, if any, does not reflect what can be achieved by average patients because the patients recruited for the new bone substitute group are not representative of them. Furthermore, confounding bias will occur, as the comparability between groups that could have been achieved by randomization is now undermined. Ideally, every eligible subject should have equal chance to be allocated to either group, but now it is not the case. So how to deal with bias caused by lack of allocation concealment? One effective method is to use sequentially numbered, opaque sealed envelopes. In this approach, the random number assigned to each patient, corresponding to treatment or control, is written on a paper and kept in an opaque sealed envelope. If a patient is assessed as eligible by the person recruiting subjects, this patient will be referred to another research staff who works independently, and that research staff will open the sealed envelope assigned to the patient and allocate the patient to the treatment or control group accordingly. The envelope ensures that the recruiter remains unaware of the allocation, maintaining the integrity of the process. Other commonly used methods include interactive voice response service. No matter which method is used, the fundamental principle is to have different people do the recruitment and the subsequent random allocation independently, and to prevent the former from knowing or guessing the treatment allocation scheme. Now let's wrap up by comparing bias caused by lack of allocation concealment and bias arising from sampling procedure from 3 different perspectives. First, study designs affected bias caused by lack of allocation concealment only affects randomized controlled trials since random allocation is a unique process of RCTs. In contrast, bias arising from sampling procedure can occur in all types of study designs. Second, cause of bias caused by lack of allocation concealment occurs when the person recruiting subjects knows the treatment allocation scheme, as indicated by the random sequence, which affects his or her decision to recruit a subject or not. Bias arising from sampling procedure, on the other hand, results from an inappropriate sampling method, where the selected sample doesn't accurately represent the target population. Finally, how to address it to reduce bias caused by lack of allocation concealment. Use appropriate allocation concealment techniques to address bias arising from sampling procedure. Use probability sampling methods to ensure every member of the target population has a fair chance of being selected. Okay, in this module we discussed how selection bias can arise from lack of allocation concealment and explored the strategies to address it. That wraps up our discussion on selection bias. In the next module, we will shift our focus to information bias. Specifically, we'll introduce recall bias, which stems from inaccurate recall. Thank you for listening.